One of the biggest tools that I think we're going to be seeing used a lot more in practice is the use of ultrasound. Ultrasound is something that used to be incredibly expensive and very hard to find. Also something where people felt like they had to be trained, like radiologists in practice, to use. In the past couple of years, there have been several protocols that have come out, the FAST protocols, focused assessment with sonography for trauma, which have been moved to focused assessment with sonography for triage, tracking, and trauma, the triple T now, that is allowing practitioners to use ultrasound in a very systematic way. As we're not trained radiologists, I'm not a trained radiologist, but it gives me a systematic approach to use ultrasound in practice to look at trauma patients, even to use ultrasound for things like cystocentesis when we couldn't get a culture on a larger breed dog. Ultrasound has become much cheaper in practice, much more readily available. Heck, you can even go online onto a eBay site and get ultrasound for a couple $100s now. Now again, every machine is going to be different as far as their level of care or quality, but ultrasound is something where more and more practitioners are getting in practice and using in a systematic and qualified approach, not only to diagnose, but to evaluate, track, and treat patients.